Bismillah ar-Rahman ar-Rahim. This is the second part of the practical lecture ECG in practice. The objectives of this lecture will be how to read the rhythm and rate in the ECG and how you can interpret them. First of all, we will talk about the normal sinus rhythm. What are the criteria for the sinus rhythm? First, the P wave are usually positive in most of the leads of the ECG. Second, every P wave is followed by a QRS complex. The distance between each P wave and the following QRS is constant, which means that each P R interval are constant in each beat in the ECG. Fourth, the distance between the QRS complexes is constant, which means that the RR intervals are constant all over the ECG, as shown in this ECG tracing. When you see a strip of ECG and you want to interpret the rhythm, there are three questions to guide you through rhythm analysis. First, is the rhythm regular or not? And what is the basic rhythm? Second, is the rhythm disturbed or interrupted by an extra beat or a pause? Which means there is interruption on the basic rhythm with a pause or an extra beat or extra systole. Third, is the rhythm replaced or switched by another rhythm? And what is that rhythm? Which means there is a rhythm switch. Now, how can we interpret the rate and rhythm in the ECG? As you know, to measure the rate, you should know the rhythm of the ECG. We have two main types of rhythm. We have regular rhythms and irregular rhythms. Regarding the regular rhythms, we have normal rate between 60 to 100 beats per minute, tachycardia more than 100 beats per minute, and bradycardia less than 60 beats per minute. And we have irregular rhythms and also interrupted rhythms, which is part of irregular rhythms. To measure the heart rate in a regular rhythm, we can measure the large squares, how many large squares between the two RR intervals, and divide 300 over the measurement of large squares between two RR intervals to know the rate of the ECG. As you see in this strip, the RR interval is about 4.7 squares, large squares. So 300 over 4 equals 75, and over 5 equals 60. So the heart rate is between 75 and 60, about 65 beats per minute. Now we will take the types of regular rhythms with normal heart rate between 60 to 100 beats per minute. First, normal sinus rhythm. In this rhythm, each QRS are preceded by a normal P wave, as shown in this strip. Second, atrial flutter. In this ECG, each QRS preceded by more than one abnormal P wave with characteristic sawtooth morphology, which are best seen in lead 2 and 3, as shown in this strip. Third, accelerated junctional rhythm, in which each QRS preceded by or followed by an abnormal, usually negative P wave, as shown in this strip. There is an abnormal P wave which precedes the QRS. Fourth, accelerated idioventricular rhythm, in which wide QRS not associated with a P wave. As shown in this strip, there are no P wave and just wide QRS complexes with normal rate rhythm. Fifth, pacemaker rhythm, as shown in the last strip. Each QRS are preceded by a pacing spike. These are pacing spike precede each QRS. And also this is a dual spikes. The first spike for the atrial stimulation and the second spike for the ventricular stimulation. Now, what are the types of regular rhythm with tachycardia, more than 100 beats per minute? We have two types, narrow complex tachycardia and wide complex tachycardia. Regarding narrow complex tachycardia, we have sinus tachycardia, in which there is normal P wave with normal QRS in each complex. Atrial tachycardia or flutter, there are abnormal P waves with normal QRS. And supraventricular tachycardia, usually no visible P waves with usually narrow QRS. This is narrow complex tachycardia. Sometimes the supraventricular tachycardia are with wide QRS due to bundle branch block. So it can cause wide complex tachycardia also. The second type of wide complex tachycardia is ventricular tachycardia, in which there are no visible P wave, just wide QRS complexes. This strip shows wide complex tachycardia, which is usually it is ventricular tachycardia. This strip shows wide complex tachycardia with a feature of bundle branch block. This is left bundle branch block. So this mostly SVT with bundle branch block. What are the types of regular rhythm with bradycardia? Less than 60 beats per minute. First, sinus bradycardia. Normal P wave and normal QRS. Second, junctional rhythm with abnormal P wave and normal QRS. You know that the junctional rhythm, the pacemaker is from the AV node. So either there is a P wave which is abnormal, preceded the QRS complex, or follow the QRS complex as shown in this strip, or there may be no visible P wave. Third, ventricular rhythm, in which there is complete heart block, so there is dissociation between P wave and QRS complex as shown in this strip. There are P wave, but the P waves are not followed by a QRS complex, and the QRS are wide complex because this is ventricular rhythm. Now we come to the irregular rhythm problems. In this figure, we compare the regularity between different strips. The first strip shows the regular rhythm in which there are constant RR intervals. In the middle, there are types of regular irregularity, and the last irregular irregularity in which there are no constant RR interval, which is disturbed rhythm. In the second part, the regular irregularity, we have bigeminous or trigeminous or single ectopic beat. In bigeminy, each normal beat followed by an ectopic beat. In trigeminy, each two normal beats followed by ectopic beat. And we may have single ectopic beats. So irregularity, we have ectopics or pauses on a basic rhythm. While irregularity, we have totally irregular rhythm. Now, what are the types of irregular rhythms? Totally irregular. The most common is atrial fibrillation, in which there is no P waves, just F waves due to fibrillation waves in the baseline of the ECG. Second, which is similar to the atrial fibrillation, is the multifocal atrial tachycardia, in which there are variable shape P waves. This is in comparison to the AF, there are variable shaped P waves with irregular rhythm. Multiple extrasystoles or multiple ectopics, either the premature beats from the atria, in which there is normal QRS, or from the ventricles, which are wide QRS complex. The fourth type is ventricular fibrillation, in which there is bizarre shape QRS complexes, wide complex and irregular with chaotic rhythm. Now, what are the disturbed or interrupted rhythms, which are type of irregular rhythms? The basic rhythm may be disturbed or interrupted by ectopics, either atrial ectopics, which is characterized by normal QRS complex with or without the presence of P wave, which is usually abnormal P wave, or maybe absent. And ventricular ectopics, which is characterized by wide complex QRS and no P wave. The second type of interruption are pauses. We have pause due to sinoatrial nodal block, in which there is a straight baseline with no P wave and no QRS complex. And we have AV nodal block, which are different types, as you know, first degree, second degree, and third degree AV block. In this type of pauses, we have the second degree AV block, Mobitz type 1, or Mobitz type 2, or the third degree AV block. Types of AV block. First degree AV block, in which there are prolonged PR interval. This is a prolonged PR interval with normal QRS complex and regular rhythm. Second degree AV block, two types, Mobitz type 1 called Winke-Bach block, in which there are excess regular P waves. This is regular P waves, excess regarding the QRS complex, with variable progressively lengthened PR interval until 1 P with missed QRS complex. With irregular QRS complexes, irregular RR interval. This is Winke-Bach phenomena, Mobitz type 1. While in Mobitz type 2, second degree AV block, there are excess P wave, regular P wave, in excess to the QRS complex, but with constant PR interval, and 1 is missed. This is constant PR interval, while this is progressively prolonged PR interval until 1p with missed QRS complex. In Mopitz type 2, we have either missed QRS complex or maybe every P wave followed by every 2p wave followed by one QRS complex. This is called 2-to-1 block, also Mopitz type 2, because there are constant PR interval. While the third degree AV block, complete heart block, there are regular P wave. This is P wave, this is P wave, and this is also P wave, regular P waves with dissociated QRS complexes. Wide QRS complex dissociated from the P waves. Usually, there is excess P wave regarding the QRS complexes in the second degree and third degree AV block. So, to differentiate between the high degrees of AV blocks, we follow this chart. When we find the number of P waves in excess to the number of QRS, there is a high degree AV block. Either PR interval constant, this is Mopitz type 2, or PR intervals variable if the QRS complex are regular, this is third degree AV block, and if the QRS complex irregular, this is second degree AV block, Mopitz type 1, which is Winky-Bach phenomenon. Why in the third degree AV block the QRS complexes are regular with normal regular RR intervals? Because the rhythm is ventricular rhythm. What do we mean by replaced or switched rhythms? A change from one basic rhythm to another one is called a rhythm switch, in which either from normal to abnormal rhythm, as shown in the first strip, from sinus rhythm to ventricular tachycardia in the form of torsade de pointes. The second strip shows the change from abnormal rhythm to normal rhythm, from atrial fibrillation to sinus rhythm by a cardioversion. Also, a pause can occur in a setting of a rhythm switch, as in this example when an atrial tachycardia terminates and sinus rhythm takes over again. Such pauses are called pre-automatic pauses. Thanks for listening. I hope you enjoy this lecture, and goodbye.